What will it look like when schools welcome students back to their buildings? And what precautions might they take to limit the spread of COVID-19 in their communities? These questions took center stage recently when the Centers for Disease Control and Prevention released recommendations for reopening school buildings, and they proposed some pretty big changes to their daily operations. The CDC cautions that these recommendations should be implemented in a way that's feasible and practical and meets the needs of a local community. It also cautions that schools that are shut down in areas with significant spread should keep their buildings closed. Here are a few key points from the recommendations. First, masks. Staff should wear masks, and students, particularly older students, should be encouraged to wear them, the recommendations say. The CDC acknowledges that younger students may struggle to wear masks, particularly for longer periods of time, and it says they're most necessary where social distancing isn't possible. Next, social distancing. Desks should all face the same direction, the CDC says. It recommends they sit 6 feet apart, which is not possible in many crowded classrooms and older school buildings. It calls for buses to seat students every other row to avoid crowding, and to limit the use of shared supplies in classrooms so that items could be more easily disinfected and kept to individual students. It also calls on schools to consider grouping students in cohorts that remain in their classrooms and avoid interaction with students in other groups, to close large shared facilities like school cafeterias, having students eat in their classrooms instead. Third, protecting vulnerable people. Students and staff at higher risk for severe illness should be given accommodations, like the option to telework or to continue distance learning, the CDC says. Some analyses find that about 1 in every 5 teachers is over the age of 55, putting them at heightened risk for severe illness from COVID-19. The CDC says schools should have plans to isolate students who show signs of illness, and if possible, to screen for symptoms like fevers on a regular basis. It also recommends that they cooperate with local health authorities to help trace the transmission of the virus and keep it contained. So, will your school follow these recommendations? State and district leaders around the country are making plans right now, and many of them are considering multi-tiered approaches that might call on schools to continue distance learning, to reopen their buildings, or perhaps adopt a hybrid approach to avoid crowding. Other countries that have reopened school buildings after closing them for the coronavirus have adopted similar precautions and face similar challenges. In the United States, one of those challenges might be state funding cuts that will make normal school operations difficult in some areas. Leaders around the country have said reopening schools is a key part of our nation's recovery. But public health officials have cautioned that until there's a vaccine or an effective treatment for COVID-19, it might not be business as usual. What reopening looks like in your school will depend on how our understanding of the coronavirus and its transmission changes, the effects of the virus and its spread in your region, and the decisions your local leaders make.